Hey guys, this is your inspirational nurse underscore RN Tierra coming to you live with another great video. Hey. Good morning, all my inspiring nurses out there. This is just gonna be just a quick talk about my experience this week, plus when I got yelled at a doctor and my response. So stay tuned, y'all. Yes, y'all. Y'all heard me right. So anyway, I want just to say, please feel free to subscribe, like, and share, and comment, and welcome for everybody who is new. Thank you for subscribing and supporting my community, guys. We are definitely growing in numbers, and God is doing amazing things, even though things are going totally chaotic and people are under so much stress right now. God is still working. He is still in control. So let's stay calm, let's stay tuned, and let's jump right up into this video, y'all. But first of all, I just wanted to make sure that I say that for all my frontliners that is out there hustling, bustling, I don't care if you're working, you're as a cash register, I don't care what you're doing. I just want to say thank you guys for your profession, your time, and your sacrifice for this time that God needs us. Some of us was called in this time, and we really don't understand why, but God always has a reason. We'll understand it later on what is going on and why is it going on. So let's digress into this video, y'all. Again, I'm Tierra, so I will be your fresh RN coming out of school. For my history, I've been an LPN for 4 years. So, yes. So let's talk about what just happened, y'all, this week. So anyway, y'all, let's just jump into this video because I want y'all to be laughing now. Y'all know I bring the energy all the time to every video. Y'all know I'll be telling y'all what exactly is going on in my facility, in my hospital that I currently work in. So currently I am an RN. I'm an A-Heart nurse, which means I am a nurse that can, kind of like a resource pool nurse, but they named it A-Heart because they wanted the nurses to have the ability to have all the benefits and a higher pay than starting out with whatever they starting out with, because I don't know, because I got that pay. So anyway, y'all, so that's my position. So I can go any med surg floor and rotate and pick a floor I want to work on permanently, or I can become a resource pool nurse, which most nurses I've been working with, they really see my skills and they like, yo, sis, you should go all resource pool, because resource pool, you'll get your top dollar and you can pick your own schedule. So, but I have not made a decision yet. I'm currently on a surgical orthopedic unit in med surg. Oh my God, the floor is amazing. It's clean, it's organized. It's a lot of work. But we will talk about all that. Let me tell you how how I got yelled at. Just my, fifth week going into my job. I wasn't the only one. And just tell you what happened, so y'all can laugh about it too. Because that's what y'all need to be doing. When people come at you guys, it is no need, guys, to have energy. Don't give them the energy, y'all. Don't give them words you be having right here. Like, you know what? You don't give it to them. They don't deserve that. Okay? And they don't deserve you coming out of character. So people are always watching when things go down. So just be mindful of what you say and how you respond. But let me tell you what this girl said. All right? Let's just cut to the chase. So, guys, y'all, y'all know I'm up to 4 patients, right? I had a patient. I was doing good. Now, when I came into work, I had a great boost of energy because I was off for like 2-3 days. I worked a day, then I was off like for 2-3 days, and then I was working like my next 2 days. And so I came in with my goals in mind with my preceptor that I wanted to work on my speed because I'm really thorough. And when you're a thorough nurse, sometimes it slows you down because you're like real particular about things, or you feel like, you need to dig deeper into something to give your patient the best outcome. So I'm that type of nurse. I'm very patient-centered. The preceptor that I have, she's very opposite. She shortcuts it, or she's young. She just gets to the charting. She does things like she clusters a lot of things together, or whatever. She has her own style. So I've thought to try to speed it up a bit, that day. But anyway, I was done everything, my morning routine before 9 o'clock, which I was so amazed at. I was like, yes, this is nice timing to be done, because I was getting like admissions and transfers and discharges like all day long because it's a surgical floor. So anyway, I had a patient that there was a discharge order for. For any discharge order that you get, it just tells you that the patient can go home. And our procedure in our hospital, guys, we call the case managers before they go home, and that's the last stop before they go. And we just say, hey, do they need any home health? Do they need anything? And the case managers make the decision on whether they can go or stay. And then we remove IVs and drains, whatever they got going on, so they can go home. But, right, so this patient was getting discharged. I discharged them the way I discharge everybody else. Patient been home for 40 minutes, and then the doctor comes on and was like, where's the patient that's in that room? And we're like, the patient went home. There was a discharge order. We sent him home. I didn't get to see this patient. Why would you send him home? I'm the doctor. These are my patients. And she was going in. This is a safety issue. Why would... And we like, first of all, you put the discharge order in the discharge summary. So why would you put the discharge order in summary if you did not want your patient to go home and you wanted to see them first? You didn't put not even a note, not a phone call, not a text, because we do text on the computer as well, to say, hey, I want to see my patient before they go home. Y'all just send this patient. You just put the stuff in to us to send the patient home. Well, his foot is wrapped, so how am I supposed to get to his foot? And I was taking care of his foot, and we just looking at her. So, guys, I'm going to give y'all a quick minute to think what I had to say to this lady. Because she was coming at us. I mean, she was coming at because I was trying to dig the chart back up. So I guess because I was taking long, she was like, well, who's training you? And so my preceptor was like, I am. And she kind of was like down and embarrassed. I wasn't, because I was just like, you ain't doing nothing wrong. We ain't doing nothing wrong. This person just needs to go sit down somewhere. So anyway, my response to this lady was, okay. She was like, it is not okay. These are my patients. You need to text me or call me every time a patient is getting ready to go home, so I can come see if maybe if I want to see them or not. I'm like, no, this is the first time we're hearing that you want this done. Every doctor usually or surgeon will come see their patients before they put the discharge order in, before they put the discharge summary in. You put it in. So that means you don't know what you're doing. That's what that tells me. So I just said, okay. Because guess what? This girl had other things going on. I had a patient going into surgery. I had a patient going down for MRI. I had to prep the patient that was going for surgery down, because you have to give them chlorhexidine baths and make sure you do your pre-op assessments and stuff. So I was just like, first of all, I'm moving on. You just looking like a fool right now, because she was just going in. Everybody looking. And then she trying to calm down, like, I didn't mean to yell at y'all. It's not anger. I just want y'all to be perfect, you know. I'm not bitch. Oh, that was what I was about to say. But I didn't do it, y'all. I was a good girl. I was like, okay. And moved on. And ever since, she been calling me. So you know what I had to say with this lady when she called me about the next one that was going home? Are you sure, doctor? Are you sure this time you want this patient to go home? Because nobody got time for you and your mood swings, all right? Everybody under stress, but you ain't going to talk to me like that. So we did do a STARS report, which a STARS report in our hospital is an incident report. If anything goes on the floor unusual, because she wanted us to write one up. And of course, it went to the meeting and got dismissed because they seen that there was a discharge order and a discharge summary. So they dismissed it. It was like, oh, so what was the point? So, y'all, let me just give y'all a few minutes to digress what I just said about what just happened. And so let me tell you, here's a tip. When something goes down, okay, y'all, and somebody is yelling and there's a whole bunch of chaotic things going on all at once, you need to be staying calm. Your patience is in the environment. People can hear. People are nosy as hell. And just stay calm and make sure that you dot your I's and cross your T's. Make sure when you put your progress note in, when the patient is going home, to put that you verify with the physician. I will put it, if it's that particular physician, that, hey, I verified with this physician that the patient could go. That way, it's in your notes. And not only that, there's a discharge order and there's a discharge summary. Now, usually in your discharge orders, if the patient, like say the doctor wants to see the patient, they will put it in the note that, hey, there's a condition to this discharge, that the patient has to be seen by a specialist before they go, or the patient has to see the surgeon before they go home. You know, so there's conditions that can be put into the discharge order. In her case, she didn't do none of the things. She was just trying to work from home and saying something about how she wasn't putting stuff in right. So obviously somebody was getting on her about what she wasn't doing right. And then she wanted to take it out on us. That's what I got from it. You just move on, because sis, y'all got like 50 other people y'all got to take care of. You do not have time to be yelling and screaming at somebody that don't know what they're doing. You just let them look like the clown, because that's what she was, you know, for the moment. So anyway, y'all, I thought it was so freaking funny. Like my preceptor, of course, she took it so hard. Like, oh my God, this is the first time this happened to me. I'm like, you didn't do nothing wrong. I didn't do nothing wrong. We follow what we follow. We had orders and the patient went. The other doctor seen the patient before the patient went. So, this doctor, it seems a little flustered because she called me again and I just wanted to say so bad, don't be calling me no more, like, but she called me again about another floor. Like, oh, I can't get none of the nurses on the third floor. I'm just so frustrated. I'm like, okay, what you want me to do? Because this is the second floor. Like, it's nothing I could do for you. I don't know anything about the third floor. I don't work on, that's the COVID floor. I don't work on that floor. So what else do you need so I can go? I'm just so frustrated. I don't have the number for him upstairs, and this is just so. I'm like, girl, get it together. Get it together. Like, anyway, y'all, I'm proud of myself because this girl back in the day would have already told her what it was, and it would have been on. It would have been on. It would have went. It kind of got ugly. But like I said, guys, sometimes the enemy sets distractions for you to get out of character, so that way you look like the one that's aggressive. You look like the one that don't know what you're doing. You know what I mean? Like, if you respond to something that you didn't do, that shows that you're guilty. That's just my opinion about that, but I could be wrong. It just shows that you're guilty of not knowing what you're doing. I was so proud of myself. I was just like, am I gonna give this doctor the benefit of the doubt? No, she don't even deserve my time right now. Like, I had a whole patient. Now, anyway, let's move on and talk about how my day went. So I successfully had 4 patients all week long, and honey, 4 patients doesn't sound like a lot. When I used to be a OPN, I can do 4 patients in 15 minutes. But in the hospital setting, when you have surgical patients, it is so much, y'all. It is a lot with these patients. They have trains. Some of them have like all types of stuff going. I had an assignment Sunday where my patient was getting potassium every hour. Then she had an NG tube. Then she had a colostomy bag. Then she had other antibiotics going. So it was like heavy. Like, those patients, sometimes you can have all 4 patients, y'all. Why does my light keep switching up? You can have all 4 patients, y'all. That is very, very heavy like that. And so the best thing you need to do is get with if you're still in training, is to get with your preceptor and say, hey, what can I do to like speed up my care to make sure that, I'm not late on my meds or I'm not late on anything that's important? Because when on a floor like that, they constantly getting admitted. They're constantly being transferred to your floor and then constantly being discharged. So you need to be like having their stuff done so they can go home and on time. They're not waiting for you. Okay, because like I said, that was one of my things I need to work on was my speed. Because like I'm very thorough and I like to, especially if they have a new incision, if they have a new drain, if they have a new amputation or something, because there's been a lot of those. Then I like to look at it really good. And you can tell, like, if the patients, whoever has the surgeon, whoever did the work, you could tell if they do good work, if they did a good job. The patient won't have any complications. The patient can go home. I did a blood transfusion, y'all, this week. Oh, yes. I hung iron this week, like the IV iron, which takes 6 hours. I had to do that yesterday. I notice I walk my patients. Most nurses don't get a chance to, but I'm like one of those nurses that get you up and going out that bed and trying to prevent the DVTs from happening, because most patients don't like the SCDs, y'all, the machine that squeezes it. They don't like that stuff. So I just walk my patients because I notice a lot of them don't be having bowel movements yet, or like, like nothing is moving because they're not moving. They're like sitting in the bed and like, I want to go home. And I'm like, well, you got to do stuff to go home like this. So I always give my patient if they want to go home, I always put that on a whiteboard. That's their goal. I want to go home. And then I explain to them what we can do to get you going, like get this process going faster. And that's just getting you up moving, making sure that you can tolerate your going from NPO to the next diet, and tolerating it without being nauseous or some people come out of surgery and they want you to advance your diet, quickly. Like they want you to go from NPO to clear liquids to full quickly, and you don't want to be the nurse to advance their diet too quickly, because then they will have projectile vomiting. Like they will have like bad stomach pains because their stomach waves, those waves are that move the food, are slowed down. They just came from under anesthesia. So you will mess your patient up if you advance too quickly. So you want to really, really assess whether they're ready to tolerate like their new diet. Like you want to wait. And baby steps. I was always told for them to use like a straw with their fluids. Um, if they're sipping, not just like drinking straight out of a cup, whole bunch of gumps, you know. Mm, mm. So anyway, that's my new coffee maker over there. If y'all can see my new Keurig, because first of all, my other coffee maker broke down. Just like my car was giving me trouble. I was like, what is happening? Like everything is just going crazy. But anyway, this is how my week has been going. Yesterday, my preceptor was so proud of me because I was done. Like everything was done. Like we had so many transfers, so many admissions, discharges, and I was getting it. I was getting it. I was getting it. And it's funny because I knew more than what I thought I knew. Like when it comes to epic and charting and stuff, it's just when you have to, when you're training, you can't have a preceptor that does everything for you. Like I had to talk to her because it was just like she was starting to do like jump in my rooms and touch stuff. I don't like it, and she knows how I am, because I'm like, I don't like when you go in my room, touch any of my patients without letting me know what you did, or tell any of my patients anything that you don't confirm with me first, because that is my assignment. Like I notice I'm very motherly over my assignments. Like I don't know, I'm very territorial over my assignments. I need to know what you did, you know? Just because you have your own routine, because she just get in the zone, she just start touching stuff and doing stuff, and I'm like, that's not being a good preceptor for me. You're not helping me at all. I'm not learning nothing. And you have to tell them that, because that way they'll know that, okay, I need to let you do your thing. And when she let me do my thing, she was like, oh, you know how to do everything. You already stripped your badge, you already transferred your patient in the system, and you did this and you did that. So I'm like, yeah, because I'm doing it. You know, when I'm doing it, then I can think. But if you constantly cutting me off and you're like, hey, do step one, I know what I got to do. It's just that I'm doing it the way I want to do it. Everybody does nursing different. Nursing is definitely an art. Just because you see a nurse do something different from you doesn't make it wrong. All nurses work differently. Some nurses, they really cluster everything. Like I used to see nurses in nursing homes give like, if there was a medication from like 7 a.m. to 12, they'll give all of it at once. I will judge that. I would never do that, because you don't want to drugs that have interactions. You understand what I'm saying? Or like in a hospital setting, it's hard to do that because your patients are constantly getting pulled off the floor. Like maybe PT will come with them. They will have tons of testing, especially on a surgical floor. They have a CT, MRI contrast, or they'll have PVLs, or PVLs is when they look at the arteries and veins for any DVTs. So they'll be pulled, or sometimes they'll do that bedside, so your patient's constantly getting ready to go to surgery or coming out of it. So your patients is not just staying in one room, like long-term care. That's the beauty. You can like have a routine down packed, and your care is done so quickly because it's the same people. So like you literally don't have to rechart anything unless it's significantly different or exceptional. You know how they say a chart exception by exceptions? That just means that the patient, you're charting something that is different from what they usually have going on. That's just what that means. But in a hospital, when you got new patients every day, you can't get through your routine as quickly as I did as an LPN. And the work is pretty different. ORN work is like, make my feet swell. OPN work, I can do in my sleep. It was just like, sometimes I'd be bored looking for other stuff to do. And not that hospital work, y'all. And that's because you're working more with your team. So you're working more with your physicians, your surgeons, your case managers. You're working, everybody at the hospital has a job. You're working with housekeeping, you're working with dietitian. So you're not just one person, like in a nursing home setting. You're definitely part of a team. So, everybody's going to be doing their job. So you have to learn, definitely, especially as a day shift nurse. I'm used to being a night shift nurse as well. So that's probably why a lot of times I didn't have to deal with this amount of this work that I'm doing now is like on times 10. As a night shift nurse, it's emergencies happen on a night shift, or sometimes it may not happen on a night shift. But during the day, it's chaotic because during the day, everybody's at work. Your managers are at work. Your educators are at work. Um, all the physicians are at work. Everybody. And so you have family that's constantly calling. Like, I love talking to the family. Now, as a LPN, it was kind of difficult because they just seems always mad or something or something. And a lot of patients in nursing homes, they just be passing on. Sometimes they come in just to pass, just to die sometimes. Instead of doing, hospice at home or something. So a lot of times I had a lot of different conversations with families, but now I love my conversations with families because I feel like with these times, it's so important to update your families on what is going on because they are home driving themselves crazy. Like, what is happening? Like, I had one that came in, transferred in at the end of my shift, and her daughter was like, "Oh my God, I live all the way out of town, and I just want to know she good. Like, I can't even see her. Is there a way you could see each other?" And I was just trying to come up with ways to see each other for them to talk because the lady couldn't really hear. It's hard in hearing and stuff. So I was just like, "Oh God, how can?" I was just trying to think of ways for them to communicate because I know I would be going crazy if I couldn't talk to a loved one or something like that's in the hospital, especially at these times when this virus is going around still. So anyway, y'all, that what's been going on. But like yesterday, she was like, "You did your thing." Like, I was on it. First of all, I was comfortable. My feet has been swollen every day while my job, so I went ahead and ordered the New Balance. I'm gonna just show y'all what I ordered, but I ordered the classic New Balance, the ones with the different colors on it, the bright colors. I didn't order there was a few other New Balance. If you go on the New Balance website, there's so many. But I was like, I can tell by the way the shoe looks that it's gonna cause me some feet problems. But so I ordered the classical ones where you can order it with wide as well. So I ordered them wide and I survived 12 hours on my feet with them and didn't have a problem. So I was extremely proud and extremely happy. So I think I'm gonna order one more pair and then that will be my go-to sneakers. Because the other New Balance I had, y'all, that works. These are the only sneakers that work in my whole closet. Now I have about maybe 8 to 9 pairs of nursing shoes, of clogs and Zanskos and things like that. But my feet was swelling. Oh my God, y'all! I never in my life wanted to chop my own feet off than I did working as as an RN. My feet and my back was killing me. When I mean I wanted to take something and literally take my foot off, it's mostly with my left foot. I don't know what is happening, but my feet. And I cannot take being in that much pain. I mean, to the pain where I couldn't walk. My preceptor walked with me to my car. I took immediately when I got in that car, y'all, them sneakers came right off my feet. I driving barefooted because I couldn't even. My foot was so swelling so bad. So I'm gonna show y'all what I ordered. But anyway, that's what's been going on with your girl. I'm so proud of myself because they hired me because they knew that I can stand my own grounds. That was another thing in my interview. I was very transparent, like I said in my other video about my interview, about what was coming to the hospital and was me. And I let them know that I don't care if you are doctor, lawyer, this person, if you're wrong, you're wrong. And you're going to know that, and I'm going to let you know. And I move on. I learned because I used to take things personally in my 20s, y'all, and be about to fight y'all because y'all said something to me. Now I don't do that. It's not even worth it. First of all, you're too busy and you're too tired. At this point of your career, you're too tired. You're like, I don't got the energy right now. But okay, like, moving on. Like, and it just shows a lot. And I get along with all the other doctors and surgeons. They've been so nice. They're so nice. They say hello. They talk to you. They see the work that you're doing with your patients. And it just shows that she was out of character rather than me. So I learned a lot. God really took me a long way, y'all. I was very proud of myself. Because this story would have been different. But I digress. I mean, in the nursing field, just know that when you're working at these times, everybody's stressed out. People are frustrated. The hospital is turned upside down. There's COVID units now. So everything's been rearranged. Numbers has been changed. We use command center. We have people sitting at the doors. You can't get in. Everybody being screened. There's no visitors. It's just so different. So you really got to take this time into consideration when somebody try to come at you about something. And just, if you can just look at them like this. Just give them that look, like, the words don't gotta come out, but you got the mask on. So if you mumbling it, they can't hear you anyway. But I would just suggest that you just move on. You got tons of other things to do, tons of other patients to do. And what one person don't like, somebody's gonna like your care. I had one person give me goggles, girl. I had shout y'all because she gave me the bigger goggles I've been looking for. They've been sold out because those small ones I cannot see a thing. When I talk, it fogs all up. It hurts the back of my ears. She seen that I was struggling because I've been transporting, like, sending my patients downstairs. I've been walking them downstairs out the door to take them home. I don't call transport. I'm one of them nurses that take that break and take my patients to the main entrance and transfer them out the building when they going home. And she seen I was all fogged up in the eyes, and so she brought me a pair of goggles, and that was just like gave me inspiration, like, to just keep pushing, in these times. And then y'all, everybody's just like, yo, my team leader was like, yo, your work is impeccable. Like, you're good. Like, are you gonna work here? I'm like, we'll see. But she was just like, I watched you. You are on it. Like, I guess nurses are still on that floor, still flustered, that been there longer than me, still trying to figure out stuff. Me, I'm on it because I came in with the skills, but I just know where I needed to be, where I was weak at. And if you come in with that attitude, like, look, y'all, I'm new. I come with some experience, but I'm weak in charting, or I'm weak in my speed of things. Like, I'm slow, or I want to speed it up. God will put you, and pray on it, because God will put you with the right person. Like I said, the young girl that I'm with, she's very fast and she charts very well. So I'm with the right person, but she thinks that I should be a critical care nurse. She's like, you are an ICU nurse. You're not an ER nurse, because you are so organized and you want things to be like really good and pretty. And she's like, I'm lazy. I'm not like you. I was like, I am a critical care nurse. They know that's my end goal. The hospital does know that, but I'm not rushing it. I'm enjoying the development of my skills and my talents. Enjoy the baby steps, y'all. Don't push it. Don't rush it. Don't be like so quick to move to those areas, because you got to be good you got to be good and taking care of the ones that you know that what the problem is. You go into situations like critical care where you don't know that they got 5 different things going on and they're unstable. All my patients, at least they're somewhat stable before they become unstable. So the care is different. But if you have patients constantly unstable, you constantly got to know what the problem is quickly and react quickly. You can't be like, oh, step 1, step 2, step 3. So enjoy your development part. Enjoy the training. And even if you come with a lot of experience, don't ever have that attitude of like, I know. Because you really don't know a damn thing. And every hospital is very different. Every charting system is very different. Every patient is unique. You cannot come in there with that same attitude or that LPN attitude. Like, oh, girl, I was a nurse for this. Yeah, you was an LPN, baby. RN, honey, that's totally different. And I hate to say it like that, because I used to get so offended when RNs used to say that. But I understand now, as an RN, the work is times 10, totally different. And depends on what unit you're on too. It's probably worse. But where I'm at is just, the work is times 10. You got different machines for everything. You got to chart every little single. I mean, charting takes like forever. You got to get quick with that. You got admissions and discharges and transfers. You got this COVID thing going on. I mean, you got drains and tubes and all types of stuff that you got to, procedures you got to do, wound vacs and IVs and all this crap. And they change the equipment. So it's not the equipment I'm used to. Even the IV, y'all. Like, I get my IVs in, right? But then my blood is not coming down the tubing because they changed their IV equipment to these new colorful looking things, and you have to loosen up the bottom part in order for it to advance the catheter, because I get into my veins, but I can't get my blood flow to come down. And I'm just like, I'm so used to my old school IVs. We just put it in, it goes right. You can advance your catheter. But again, things change, medicine change. So please don't come in with that attitude of, I don't know everything. And I'll make sure they know that I'm in training. And enjoy your orientation time. That's the time to question everything. That's the time to say, hey, this is not for me, or this floor is not for me, or this speed of work is not for me. This is the time. So enjoy your orientation, y'all. I would. Anyway, I hope this video was entertaining, y'all. I had a week. I'm so proud of. I hope y'all proud of me. I have worked my butt off. My patients survived All my stuff was done. All my eyes and nose, every little thing was done. Patient is no complications. God is good, y'all. Just he's good all the time. So anyway, I'm gonna chat off. I hope you guys are doing extremely well. I know you guys are under pressure. Please do not lose your faith in God. He is still working. Take your money, save your money, y'all. I've been working on saving. It's another thing. Every other check, just saving, because you don't know how long this is gonna last. Please save your money, because I bet there's gonna be more nursing job opportunities, nursing school opportunities and stuff when this is all over with. This is right now, they made everything easy for you to pass nursing school and pass the NCLEX. That's what I heard. So that they're making everything easy for people to get through because they need more nurses. So if you guys are looking to get back into it, or you want to join the fight, please join the fight. I know this is not an army recruitment video. This is a nursing recruitment. Please join the fight. We need good nurses out here. We need the help and support. People are leaving their jobs left and right, honey, because they like, I'm not feeling this. I didn't sign up to be killed by no virus, but I did sign up to be a frontliner worker. That's what I signed up for. I don't go in to work with an attitude. I don't leave with one. I go in knowing my risk, okay? Just like when your doctor tells you your risk, I go in knowing my risk, okay? Know your risk. And if you're not ready and you feel like, I don't want to take that risk, then don't. Nursing, you can do anything. Open up a business. You can work from home, work for insurance companies, and look at charts all day. There's so many opportunities. You could go to school right now. There's people looking for nurses to go to school. Go to school. Look for these scholarships right now, okay? We need your help out here, y'all. I know the talent is on this channel, first of all. And please share this video. Let's grow this family, y'all. I love y'all. I love my YouTube family. I miss y'all. I'm going to try to get some more content out. I'm off on one day right now. My schedule is all messed up this week. But I'll be back to work this week. I'll have 5 patients. I'll let y'all know how that go. You know, I'm not going to let y'all know how something go unless I finish and complete my work. Then I'm going to let y'all know how it go. All right, so you guys stay tuned. Look out for the next video. Take care of yourselves out here.